So I want to put in context, I think I have the most boring question of the night. You've had some great questions tonight. But I want to put in context who you have on the stage tonight. So to my right, you have providers who represent about $10 billion or more of healthcare spending in Massachusetts just in their hospital and physician practices. To my left, you have the insurers, especially if you include Harvard Pilgrim, who's represented in your packet, who represent more than 85% of every single person who's commercially insured in Massachusetts. So you have an extraordinary wealth of commitment here, and I think what many people have said is true, which is that Massachusetts is very unusual in the commitment of these people. And I'm going to tell you a little bit about how I answer this question in relationship to the commitment that we have, but also the commitment we have to improve this world and keep people accountable. So I can tell a little bit of history in order to answer the question of what kind of information we have. So 20, 30 years ago, there was something called the Rate Setting Commission. The Rate Setting Commission set hospital rates for all payers, not just Medicaid, but actually commercial payers as well. And at that time, that agency, the Rate Setting Commission, had a lot of expertise in hospitals, in hospital costs, and hospital payments, and reimbursements. And that expertise flowed into an organization called the Division of Healthcare Finance and Policy. The Division of Healthcare Finance and Policy, which was a successor agency, enhanced that ability to understand hospitals, but then also branched out into insurance coverage rates and premiums. And eventually, with the passage of the healthcare reform bill that you worked so hard to create, also expanded into understanding the finances of insurers and further expanding into understanding profits and relative prices and total medical expenditures, all of the statistics that you've heard all night. So those two agencies really started in an expertise in hospital information, moved into an expertise in insurer information, and now, with the creation of CHIA, we've built on that foundation. And we're really combining those two things to think about the whole healthcare system and how to understand the whole healthcare system. And the next frontier is really physician organizations and integrated organizations and how to understand integrated organizations. So I believe this question is about the Health Policy Commission and what we're going to do for the Health Policy Commission. But it's really broader than that. Last week I met with Ms. Walsh's organization to talk about how we can provide information to the Boston Medical Center to help them provide care in a more integrated way. I work on a committee with Dr. Tabb and around health information exchanges, which is what we were talking about, Ms. Harper is looking for, to be able to exchange information more effectively at a clinical setting. I work with everybody on this table, including Dr. De La Torre and Dr. Gottlieb, in thinking about how we can report on the system more effectively, be more transparent, and really, at the end of the day, help you understand it. And then the other thing I want to say, because it's really important, I want to take every opportunity I have to say this, that what we do isn't possible without what they do. So the amount of energy and effort that the payers have put into creating data sources for us to be able to illuminate the healthcare system has really been extraordinary. So I expect you to keep me accountable, but I also expect these folks to keep me accountable, because that work is really important and it couldn't happen without them. So we draw on information from here, we try to give it back to these folks. We're going to give it to David Seltz, you're going to meet in a second, and ultimately we want to give it to you, and that's the work that lies ahead of us, is increase transparency and increase access to this information throughout the system. So thank you.
Thank you, Mr. Burrows. My job right now is to introduce who will lead us into